somewhere between 5 and 10% of folks that are hospitalized with COVID are still ending up in the ICU, and some of them are needing ventilators. This high rate of morbidity and mortality. This is not the flu, and this is not a cold.
A lot of people have bad cold. It's just the same. It's not changed. It's been the same. It's like 2 months of the same. Only 10% of our COVID positive admissions are admitted due to COVID. Virtually none of them go to the ICU. They are not intubated.
LA County experiencing continued increases in the number of COVID positive patients, 1,329 today. 11% are in an ICU and 5% are on a ventilator.
We have approximately 40 COVID positive patients in the hospital. 5 were admitted due to COVID. So what we've been seeing for the last couple months is continuing to hold as of today.
The stress on the emergency department is true. There are a lot of patients that are coming in for COVID. The urgent cares and the emergency departments are very busy.
You know, lots and lots of people that are sick.
None of those people have severe COVID. We have not had one of those in quite some time at this point. Approximately 45 COVID positives in the hospital. 5 were admitted due to COVID and actually don't need to be in the hospital at all.
1,242 hospitalizations reported today. 11% are in an ICU and 7% are on a ventilator. 16 deaths per day.
4 of the last 5 days, we have had no admissions due to COVID.
As you say, more or less the same.
Today, we're reporting average of slightly over 3,500 cases per day. 11% are in an ICU. 6% are on a ventilator. 13 deaths per day over this past week.
We actually have not had an admission due to COVID in 6 days and have had nobody go to the ICU in that same period of time, obviously. Does this feel like the transition to endemicity?
I think we've already transitioned to endemicity over this summer. Well, endemicity means that as opposed to saying this is a pandemic that comes in and is killing everyone, it's just something that's circulating like rhinovirus, which causes the common cold.